Hello everyone, I'm Kibin Alleyne and today is Tuesday, February 4th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Heart disease is very common in the United States. It is the leading cause of death for men, women, and people of most racial and ethnic groups. In 2022, 1 in every 5 deaths in the United States was caused by heart disease. This disease is preventable, yet more than 800,000 people die of cardiovascular disease every year. Here to share some information on preventable methods is the Section Head and Director of Clinical Cardiology at Montefiore Health System, Dr. Leandro Slipczuk Bustamante. Doctor, thank you so much for joining me.
Thank you for having me, a pleasure.
Now, why is heart disease still the leading cause of death in the United States, despite being very preventable?
Just like you mentioned before, this is preventable, but we're still not doing a perfect job addressing the root causes. And the risk factors are high blood pressure, diabetes, smoking, not being physically active, some genetic risk factors, unhealthy diets, and obesity. And a lot of people may not know that they have these risk factors. Some of those, like high blood pressure, may not be felt unless you check it. High cholesterol, you may not realize you have high cholesterol until you measure it. So I think we have a lot of people that have these undetected risk factors for many years until they have a heart attack, until they have heart failure. So what we're trying to do is trying to shift it from detecting events to prevention, to detecting if you have what is called subclinical disease. You have some plaque in your arteries that could put you at risk for a heart attack, but we can detect it early, treat it early, which is easier, cheaper, and more effective.
Now, as you mentioned, high blood pressure contributes to heart disease, but I'm curious to know, why is it such a challenge for people to kind of control that aspect of their health?
I think the key for that is that you don't feel it, like I said before. I have a lot of patients that they come to me and I ask them, how's your blood pressure at home? And they may say, I don't feel it, it must be good. And that's a mistake, because you may have high blood pressure putting you at risk and not feeling it, so you can just measure it. It's very easy. You can get a blood pressure cuff in the pharmacy. You should tell people to measure it at least 3 times a week, and then they can bring me a log so we see what's happening there. Also, there's a lot of new devices that can measure your blood pressure at home and transmit it to your doctor, so we can know how you're doing when you're not at the office.
Now, what are some common misconceptions about heart disease that you'd like to address?
Sure, this is very important. I think one of those is that it affects only men. The other one is affect older people, and that you may feel something before a heart attack happens. So many times by the time you have a heart attack, you didn't have any symptoms before. So we need to detect this in young people that can have also heart attacks, in particular if they have risk factors or genetic conditions like a family history of early heart attacks. We need to also screen women that may present with different symptoms than men. And we need to make sure that we see risk factors and we detect them early before people have a heart attack or a cardiac arrest or other conditions.
And I also want to briefly just mention that you said it's not just older people. What would you say to encourage more younger people to kind of prioritize their health in that manner?
So yeah, the age usually we see a heart attack is 65 in men or 70 in female patients, but it has happened a lot more recently also in younger individuals. And a big factor in this is obesity, smoking as well. And so we really want to do early detection. So if you're in your late 30s, early 40s, it's a great time to see a preventive cardiologist to see what risk factors you have, how can we address them early on. So even if you have no symptoms, it's a perfect time, I think, to check on your heart and make sure it's healthy.
Now, Montefiore is always doing so many things to kind of help our community stay educated on health. Can you explain what Montefiore is currently doing to raise awareness about heart disease?
Sure. I think something that we're very happy on how it's going, and I try to encourage patients also to see it, is this Monty Heart lecture series we have on YouTube. So we created a free channel that people can watch on YouTube with medical advice, with lectures from experts from all over the world that otherwise you have to pay to go to conferences or see. And many of these can be seen by patients and are at the level that they can understand. So that's freely available for everyone. We're also providing a wellness clinic where people can come and check on not only disease, but also in their wellness, find a healthy diet, find ways to cook healthier, to stay active and exercise, and to change all these risk factors that we were talking about.
Now, what are some simple, actionable steps people can take today to reduce their risk of heart disease?
Sure. So detecting risk factors is what we talked about. I think other than that, we need to move more. We were talking before that we're meant to walk 20, 30,000 steps a day, but the average American walks about 3,000, 4,000, so that's not enough. We have a lot of devices like phones, watches now that can count our steps, and those can keep us accountable. So I think that's a great thing. So we should try to reach about 10,000 steps a day, and we should do also physical activity. We recommend about 150 to 300 minutes of moderate intensity or 75 to 150 of high intensity physical activity. But the important thing with these guidelines is that they shouldn't discourage people to move. So any physical activity is better than none. So slowly increasing your step count to try to reach that target, and starting more of an exercise program and doing some weight training is also great for your health. And this is very easy to do. Everyone can do it just by going out and walking. The important thing is if you do have heart disease, if you have any condition, you may want to check with your cardiologist to make sure that you're strong enough to start a program like that.
And I also want to add, as for walking, it's something that I've done a lot, and it's free. Like it's free to do. It's something that most people, have the ability to do. So I definitely just appreciate you, kind of highlighting that that's something that is a simple thing that people can do to kind of prioritize their health. Now, I want to talk about diet and how that could impact, heart health. Are there any specific foods that you would recommend incorporating or avoiding?
Yeah, absolutely, and that's very important too. I think so. The key is understanding also your social background. People come; they're not all the same. People come from different cultures where different foods are important for them. But overall, I think we need to stay away from ultra-processed foods. I think ultra-processed foods are now the worst problem we have with diet. And a heart-healthy diet is usually a diet that is more rich in plants, with less meats, and definitely less processed foods. If you decide to have meat, try to have it in moderation and try to have from your plate, smaller portions, and most of your plate should be filled by vegetables. The other thing I think that is important is to try to limit the salt, in particular if you have high blood pressure, and to try to limit alcohol consumption as well. In particular, if you're overweight and you're trying to get healthier and more in shape, you should try to avoid alcohol, because it doesn't really help you to get fit. It can make you more prone to arrhythmias. And if you decide to drink, try to keep it minimal, usually a day a week, and try to decrease it slowly, but it can be done. It's just a change in our habits to reach it.
Now, the next thing I want to talk about is very important to me, and that is sleep. How can sleep impact your heart health, and how much sleep should we be getting to kind of be a little bit more healthier?
Yeah, that's essential, because if we don't sleep well, also we're going to be craving more caloric foods. We're not going to be working out as much. So it will affect our whole other risk factors as well. We usually recommend 7 to 9 hours. That's kind of the average, but it also should be good quality sleep. So if you drink before you go to bed, we know that that will affect the quality of your sleep. We know that if you have conditions like sleep apnea, the rest that you will get will not be restoring, and that will also affect the quality. So if you notice that you're snoring a lot, you notice that you're tired during the morning, and then you should check with a sleep specialist to make sure you don't have sleep apnea. In particular, if you have obesity, these are things that can be addressed, but should be detected as well, like we were talking before, and that will make you sleep better and will decrease your heart risk.
Now, we talked a little bit about what Montefiore is doing for heart health just in general, but for some of the things that we discussed just now regarding, exercise or diet, are there any resources that Montefiore provides to help people kind of prioritize those journeys so that they can have better heart health?
Yes, we have our wellness clinic that is led by Rob Osfeld that focuses, like I was saying, not in disease, but in preventing disease, in improving your wellness. There are resources on our websites, there are resources from the American Heart Association, American College of Cardiology, the American Society of Preventive Cardiology. And I know nowadays people look everything online, right? So it's very important to go to good sources, because if you look online, you can find everything. Some things are things you want to rely on and some things you don't. So try to go to websites like Montefiore website, try to go to American Heart Association, American College of Cardiology, the American Society of Preventive Cardiology. Those can give you, I think, good tips on how to get healthier.
And I want to touch on smoking. How can smoking and vaping, which I understand is very popular amongst a lot of younger people, affect, heart health? And what resources are available for those who are trying to quit?
Yeah, so when you compare the US with other countries, I think we've done quite a good job also pushing people to stop smoking. There are countries where it's a lot higher, but in particular in areas with, people are more struggling, underrepresented, and there's higher incidence of smoking. And this not only costs a lot of money, but it's slowly harming your health without you realizing about it. So I think that's the biggest step. If you're smoking, the biggest step you can take now to improve your health is to stop smoking. And there's a lot of options we have now. You have patches, you have nicotine, gum, you have even some medications that you can take, and this can be prescribed by your primary care physician. So ask for it, say that that's your intention, but you need a date. That's what I tell patients. If you're going to quit, you need to set up a date and quit, because otherwise we keep postponing it and just never happens.
That's good. And I love that you said that because I think a lot of it is mental. Like people will want to change, but to have the determination and the drive, the discipline to change can also be a challenge. So I love that there's, doctors also thinking about that aspect of changing.
Yeah, for sure. And there's a lot of new medications that also can help, to lose weight. And I know these are, people see it on the ads. And these are very important. And I think we think that are changing the way we treat obesity. But they should be done in combination with exercise. Cardiorespiratory fitness, so how fit you are when you exercise, is a significant marker of how long you will live. So this is very important that every aspect of weight loss is combined with exercise.
Well, doctor, I want to thank you so much for joining us and having this very important discussion that I know people, I think from all ages, can definitely benefit from. So thank you so much for joining us.
Thank you very much for having me.
To learn more about how you can prevent heart disease and the efforts made by the team at Montefiore, please go to their website at montefiorehealthsystem.org. Don't go away, we'll be back with more Open after this.